Hey, future respiratory therapists. Lastly, we're going to be talking about obstructive shock. And I'm kind of shocked that we got to this last video. So, when we're thinking about obstructive shock, I want you to think obstruction. Um, this is typically caused by some type of extra cardiac pump failure that decreases cardiac output and decreases venous return. Another way to think about it is JVD, low BP, um, lack of systemic or lack of sound activity. There we go. So a lot of the vital signs are pretty similar to the other types of shock that we have seen so far. So we've got like tachycardia, tachypnea, dyspnea, hypotension. All of those could play a factor when it comes to um, obstructive shock. So I wanted to make sure that I included this picture of what a cardiac tamponade is, because a lot of the reasons that you would choose a specific imaging tool is to identify if it is a cardiac tamponade. Obstructive shock and cardiac tamponade are kind of interchangeable in the situation. Obviously, obstructive shock could also present as like a tension pneumo or something else, but for the purposes of the imaging, that's what we'd be looking for. So for a pericardial tamponade, we would actually see decreased hemodynamic values across the board, whereas in number 2, we see that it is increased PCWP. So it's a little different depending on what the obstruction is and why, because it kind of manipulates where it is in conjunction with the heart and the lungs, and that is why it's increased or decreased. So for this slide, I just kind of lined them up with what we want it to do. So like with norepinephrine, we want it to increase MAP, right? And then with the beta-1 receptors, we want it to increase the stroke volume and the cardiac output. So I just kind of lined it up across so that way it would accurately reflect what we were hoping to accomplish by initiating that medication. So the key here is that we really want to keep the PEEP and the tidal volume at a minimum to account for the intrathoracic pressures. So we want to make sure that those are kept minimal. Pressure control or PCAC or VCAC are going to be our best friends. They're going to help manage that blood gas, keep the patient as hemodynamically stable as they can be. And then we see with positive pressure ventilation that we really have to be careful because when it comes to venous return and cardiac output, those can be altered depending on PPV. So, yeah. So by now, it probably seems like I'm beating a dead horse, but for this type of stroke, we also could have a metabolic acidosis, so that's a decreased pH, a decreased bicarb, and possibly an elevated CO2, at least a little bit just to compensate. This is usually because of the lactic acid buildup and the hydrogen ions. Those can all play a part, so I just wanted to make sure that I included that in here. Obviously, we want to focus on balancing that blood gas. Depending on how low the bicarb is, we'd probably give the patient bicarb to kind of help them along. Okay, so to kind of summarize, obstructive shock is an obstruction. So it could be like any chronic issue that is obstructing blood flow and preventing the heart from adequately pumping blood in and out. Um, so this can be a real critical and life-threatening issue, especially when we see it in like a cardiac tamponade where it's an emergent issue, or you can have a tension pneumothorax, or some type of like mass. And so typically the patient's blood pressure will just drop just like that. And all of a sudden they go from being okay to not being okay. So we want to make sure that we're really observing and aware of the patient and um, monitoring all of those vitals. Hemodynamics obviously do come into play, but I feel like in this situation, a lot can be said for just looking at the patient and focusing on the patient above everything else. And then making sure that we're urgently addressing the issue and treating it. And then lastly, here are all my slides, or not my slides, sorry, here's my slide of my references. There's actually a lot of information online about obstructive shock or cardiac tamponade. Very interesting, a lot of reoccurring information, but still very interesting nonetheless.